Hello, thank you for joining me today. My name is Warner Blumenthal. I'll be presenting to you the Aerosol Cyst by Pivotal. So before I get into any details about the aerosol cyst, let's talk about a long-term problem in the dental industry. Dentistry is always ranked as the highest risk profession for contracting airborne illnesses. Hygienists and dentists alike tend to lack access to assistance currently, which makes it difficult to control your aerosols with a lot of components that are available nowadays. Long-term exposure to aerosols is a health issue. This is comparable to not brushing your teeth on a regular basis. First time you don't brush your teeth, not that big of a deal, but not brushing your teeth over a long-term period starts to lead to oral health issues. Similarly, being exposed to aerosols on a long-term basis will start to cause long-term stress on your respiratory system. Additionally, implementing different types of aerosol suppression devices can be taxing ergonomically on the hygienist or the dentist. So therefore, we wanted to develop something that not only addressed aerosols, but also addressed the problem of ergonomics in this industry. So what is our solution? Our solution is the Aerosol Cyst, which is an ultra lightweight, hands-free, autoclavable, extraoral system that removes intraoral fluids and up to 90% of aerosols produced during every procedure. So before I get into details about the Aerosol Cyst, I want to pause real quick and acknowledge how far we've come in the short time that we've been around. We started up in January of 2021, and since then we've been blessed to get the Cellerant Best of Class Technology Award for Best New Hygiene Product. Additionally, we are currently a finalist for the Dr. Bicuspid Award for the cuspies of the Best Hygiene Product for 2022. How does the Aerosol Cyst work? The Aerosol Cyst is a very simplistic device comprised of two channels. One is dedicated to removing intraoral fluids. The other is dedicated to removing aerosols during every procedure. It's a hands-free device, hangs onto the patient's buccal plate, and protects both the dentist and the patient from aerosols produced. So now let's see a little bit more detail about the Aerosol Cyst. So in this video, what I'm going to show you is a quick setup. What we're doing is we're using a standard saliva ejector, but instead of putting it into the low volume, what you're going to do is put it into the anterior entrance of the aerosol cyst, pull it past the pinch point, and connect it directly to your HVE. So instead of just simply using a standard saliva ejector in the low volume, you're using the saliva ejector in the HVE, and now you're getting double duty, not only intraoral fluid removal, but also high performance aerosol suppression. Let's look at the anatomy of the aerosol cyst. We have a posterior line and an anterior line. The posterior line is where we're going to be installing a standard saliva ejector. We also have a 35 millimeter aerosol port at the top dedicated to removing aerosols during procedures. Here are two saliva ejectors. You'll notice slight differences in the overall length. Either way, you can use any standard saliva ejector with the aerosol cyst. We recommend lubricating the posterior line with a little bit of water, then bending the saliva ejector at the tip, and then installing that into the posterior line of the aerosol cyst. Push it down until you feel a hard stop. You should have about 25 to 30 millimeters left. Now that the saliva ejector is fully inserted in the posterior line, you want to pull it past the pinch point. In order to do so, make sure you pull perpendicular on the saliva ejector in order to avoid making any kinks. Once the saliva ejector is pulled past the pinch point, it's fully adjustable to the comfort of the patient. Then you want to push the saliva ejector down to the body of the aerosol cyst and bend an S-curve in to avoid the soft tissue. Once the saliva ejector is properly positioned, you can remove it and reinstall it without having to worry about adjusting the saliva ejector again. You shouldn't have any issues with saliva pooling at the bottom. The saliva ejector is actually adjustable. You can pull it out, pull it back through the pinch point again, and then reinstall it in order to reach deeper cavities. If you do notice that saliva is starting to pool, it could be obstructed by soft tissue. What you want to do is remember that you can actually adjust the position of the saliva ejector, and that way it can work properly. There shouldn't be any instances where there's saliva pooling or you're causing erythemas on the skin, as the saliva ejector can simply hover over soft tissue. Now let's see the aerosol cyst in action. What you see here is what we call aerosol visualization testing. This is something we developed during the R&D phases to make sure that we can benchmark our product as we implemented improvements. So what we have here is the same setup on the left and the right. You have the same lighting, the same scaler at the same setting. And what we're doing is we're simply benchmarking the aerosol cyst against a standard saliva ejector. So what you'll notice on the right is even as we move the scaler around the perimeter of the patient's mouth, you'll see little to no aerosols being accumulated, and also those that are getting pulled directly into the aerosol cyst. When you compare that to the left, you'll notice that the patient is actually covered in liquid. In addition to that, as the patient is inhaling and exhaling, you'll see the change of direction of those aerosols from the scaler. This is something that is not visible to the naked eye with normal lighting. So this isn't doctored up. We didn't do anything special to the scaler. All we did was we actually provided some uplighting and a black background. When you do this live and you're looking down at the patient, you actually cannot see the aerosols being produced. So it's something that's very hard to visualize unless you have the proper lighting and a black background. And at that point, then you start to really realize the amount of exposure that you, the practitioner, and the patient will have. This is what we call splatter visualization testing. What the doc is doing here is actually doing a mock cleaning from canine to canine on the top and the bottom. And the important things to point out to the client is the drastic difference in the accumulation of splatter when using a standard saliva ejector versus when using a aerosol cyst. What we did in this test is we actually used a non-toxic photocurable dye. We ran it through the scaler, and then we flooded the operatory with black lights in order to much easier visualize where the aerosols are accumulating and see if we were actually effectively doing a good job in reducing that. So when you notice a patient on the left, you actually notice accumulation of the aerosols and the splatter, more specifically, on the patient's cheek, ear, neck, hair, and then you'll also, even more shockingly, see the accumulation around the nasal passage, which will indicate inhalation. When you compare that to the right, where we have the aerosol cyst in place, you'll notice there's near no accumulation of splatter on the patient's face, also on the practitioner's hands and tools. So it offers a superior service to the patients, and it offers a much easier method for the practitioner to be able to manage the aerosols without using their hand for that. You notice that in both of these videos, the practitioner has both hands free to use their mirror as they've been used to, as well as use a standard saliva ejector. So there's no real change in the workflow, and that's something that's very important to point out, is that you're using a standard saliva ejector. The only difference is you're running it through the aerosol cyst into the HV line, and you get back to work as if there was no pandemic to begin with. The aerosol cyst is a very versatile tool and can also take care of fumes generated by laser procedures. So what you'll see in this video is actually a video of a fibroma being removed. On the left, you have the aerosol cyst, and on the right, you have no aerosol suppression implemented, only a saliva ejector. You'll see the drastic difference in the amount of fumes that are generated on the right versus the left. The aerosol cyst is actually able to very quickly and effectively suck in these fumes, keeping the practitioner safe. If you look very closely at the video, you might see some of the plumes jet into the aerosol cyst. And this is something that is very important to indicate. These fumes are actually very toxic. There is a study on JAMA Dermatology which states that laser plumes have been shown to actually transmit disease. They go on to say that strict care must be maintained by the laser practitioner to minimize potential health risks, especially when treating viral-induced lesions or patients with viral diseases. So now let's continue looking at the versatility of the aerosol cyst. We already saw that it could be used very well with scaling devices, high-speed devices, laser. This is another laser procedure, a gingivoplasty. The aerosol cyst allows the practitioner to use both hands like they've already been used to using, where they can use their mirror, their laser, their scaler, whatever it might be. They can just go about doing their job the way they always have been while automating intraoral fluid removal. And also the added benefit that you'll notice in these videos is that the aerosol cyst also works as dynamic lip retraction. So it's a multi-tool which automates a lot of the busy work. Let's not forget about ergonomics. The aerosol cyst was tested on many different patients. What the aerosol cyst does is removes the weight of the HV line from the practitioner and places it onto the patient. Using a comfortable buccal plate, the aerosol cyst is able to connect to the patient comfortably, hands-free, and therefore relieving the burden of the weight of the HV line on the practitioner so that they can comfortably work while automating the removal of aerosols and intraoral fluid. Thank you very much for listening to this presentation of the aerosol cyst. As a token of appreciation, please follow the QR code or the URL listed on the screen. That way you can take advantage of an exclusive discount.